Thank you. We have to apologize. I know that somebody mentioned on our chat that the initial invite was for 5 o'clock, but as things happened today, the debate on this bill was actually changed from tomorrow till today. So we had to allow room for Peter, who is the mover of this bill, to be able to shut debate. And so he should be joining us very shortly. And of course, Heather McPherson is the Deputy House leader, and she also needed to be present in the debate. So we truly apologize for any confusion or any inconvenience, I guess, in terms of participation. We will be filming this, so videoing it and sharing it online as well, so people will have the ability to share if they had other commitments that they needed to leave for, or if they simply couldn't join us. So thank you again for your patience and definitely for being here with us tonight for a very timely discussion on an area that advocacy organizations have been advocating for decades now. And we're finally seeing some movement around the issue of Pharmacare. So I want to welcome you officially to our webinar tonight. My name is Sandra Azokar, and I'm the Executive Director of Friends of Medicare, and we're co-hosting this event with Brianne Gortson, who is the Executive Director of the Manitoba Health Coalition, if I mispronounce your title.
Gertson.
Sorry, Brianne Gertson from the Manitoba Health Coalition. Although we work together all the time, I mispronounce her name. So Brianne, do you want to introduce the Manitoba Health Coalition to all our guests?
Yeah, most definitely. Thanks everybody for joining us tonight. It's very exciting to be a part of this. The Manitoba Health Coalition is one of the newest health coalitions in Canada. We were established in 2018, and we fight for the preservation and the expansion of universal public health care. And we have a firm stance against any efforts of privatization within our healthcare system. So I'm really excited to be joining with folks today, especially from a fellow prairie province of Alberta. This is our second webinar that we're doing together, given the similarities that seem to be taking place both politically as well as how the COVID pandemic is rolling out for our provinces. So thanks very much for allowing us to be part of this with you, Sandra.
Thank you, Brianne. And for all of you who are not familiar with Friends of Medicare, all those people joining us from across the country and from Manitoba, Friends of Medicare has, since its inception in 1979, been advocating for the protection and expansion of our universal public health care system through publicly funded and delivered health services that are accessible to all, regardless of their ability to pay. We are a coalition of many individuals and organizations, including physicians and patients, senior organizations, cultural, faith, and community groups, and labor organizations who represent workers in both the public and the private sector. So this is one of those areas that we have actually, along with our colleagues around the country and as members of the Canadian Health Coalition, have been working very hard to make it a reality. We're gonna start with Brianne doing a bit of a land acknowledgement.
Yes, thank you. So today we have people from across Canada and Indigenous territories joining in this virtual event. Folks are located across multiple First Nations, Inuit and Métis territory, numbered treaties and/or unceded territory. I'd like to begin by acknowledging the harms of the past and a dedication throughout our work in moving forward towards justice, reconciliation, and in our context today, public health care, access, and equity. And Sandra is going to take us through some housekeeping items now.
Thank you. I can't tell you where your bathroom is because you're all in your houses, but I just wanted to mention the fact that the only people that you will be able to see are actually the panelists. So you won't be able to see yourself, but what we do is we do encourage you to actually put your questions up on the questions and answer icon at the bottom. Don't put them in the chat because the chat gets really, really busy and we're not able to pick up your questions from that little screen. So what will happen is that we will have presentations both by Heather as well as Peter Julian, and then we will open up the forum for questions and answers. We will try to get through as many questions as possible. If we leave some on the table, we will make sure that they're directed to whoever the question was for. And then at that point, we will be able to get them answered. And actually, I'm having the same difficulties that I can't see the question and answer icon this time. So I don't know if Alyssa can make sure that that's there after we do our little presentation. She has no clue, which is why she's looking. So maybe while we fix that, we will pass it on to Brianne to actually tell us a little bit of what is going on in Manitoba currently. Like she mentioned, we do have very similar governments that sometimes need to be pushed gently into doing the right things, for a lack of a better word.
Yes, gently is the word I always change out. So Manitobans are actually very friendly folks. We are community minded and are always happy to help out our fellow stall driver. And in these temperatures, it seems to be happening a lot. But by the ways in which our government has approached healthcare and pharmacare is quite the opposite of a friendly Manitoban. And in fact, there is it's a very clear lack of enthusiasm for the creation of a national pharmacare program from our premier and his government. The political reality here is very much similar to the conditions taking place in neighboring prairie provinces, such as we're seeing in Alberta and also in Ontario, to be quite frank. Premiers that are all too quick to reopen and start peppering their press conferences with empty platitudes and still maintain an inability to support the citizens of their provinces. We all understand that a national pharmacare program would make a huge difference in the lives of millions of Canadians, including Manitobans. The savings from the ability to bulk buy medications and the increase in better health and less trips to the emergency because folks can actually access their medication is forward thinking. And it also requires the bandwidth to understand public policy, but also the interconnectedness of our health and the need to access prescription medication. However, the proactive healthcare planning that benefits all Manitobans is not the forte of our current premier or government. Instead, Manitobans have endured years of cuts and austerity measures that has truly set the stage for the devastation that is COVID-19. In September 2020, our premier, in response to National Pharmacare Program, said, "If the foundation of your house is beginning to crumble, do you redecorate the second floor sitting room?" So let's unpack that for folks. The foundation Pallister, who is our premier, is referring to is healthcare. And the crumbling of the system is, in his opinion, due to the failure of the federal government to provide adequate funding. And the second floor sitting room is, of course, Pharmacare. The use of the second floor sitting room elicited many reactions from friends and colleagues, i.e. watch your privileges showing. But what is more telling about the use of this phrase is the clear extravagance that a national pharmacare program is to Pallister and our government. And it is not their priority. In fact, this government cut a special drugs program that's used to cover pharmacare deductible for people with chronic and serious illnesses, leaving them without. Pallister has plugged our provincial pharmacare program as adequate enough, even though funding to this program has remained stagnant over his term in office. What's very interesting is recent Angus Reid polling would tell a different tale about how Manitobans view national pharmacare program. In late October 2020, they released polling that demonstrated clear, undeniable support of Manitobans into the tune of 75% supporting our government's participation in a national pharmacare program. And further, a full 70% flat out rejected the following statement. Most people have some kind of drug coverage through their employer or their own private insurance policy, so it's unnecessary to create a universal plan for everyone. Manitobans clearly want national pharmacare. So with the majority of Manitobans supporting the participation in a national pharmacare program, it would be prudent of our premier and government to understand the impact that this would have on the lives of every Manitoban. So the sitting room comment. We can agree that the foundation of healthcare is shaky, and that is in part due to the inadequate funding from the federal government. However, The cracks that Manitobans are experiencing at the hands of this pandemic has been in large part due to the decisions this government made under the guise of making healthcare better, which has seen emergency rooms close, the exodus of nurses and frontline workers from the field, inaccessible healthcare services, closures of cancer care, redeployment of staff to manage inadequate staffing levels throughout all our healthcare facilities, and the failure to increase funding to healthcare past inflation for years. And of course, the continuation of ignoring the plight of healthcare workers, patients, and Manitobans. I can pepper folks with the stats and the numbers, but remember that this national Pharmacare will impact the lives of Manitobans, Albertans, and every Canadian struggling to afford their medication, trying to decide whether they pay rent or their drugs. Bearing witness to my own mother making these decisions is burned in my memory, and being the family that received the samples from the doctor to try and remedy whatever ailment we had at the time is an experience as a child as both steeped in shame and embarrassment. But as an adult, it is this heart-wrenching experience of watching my mom decide between food and her medication that has solidified my support for a universal national pharmacare program. And I'm proud to work for organizations such as the Coalition to keep pushing for national pharmacare. We must ensure we have a national pharmacare program that ensures no Manitoban or Canadian is left behind. And this bill is a major step forward in this endeavor. Thank you. Now I pass it off to Sandra.
Thank you, Brianne, for bringing us up to date. I think in Alberta, we share similar experiences when it comes to identifying the need for a national pharmacare, and which is why we have been advocating and been fighting for it for so long. As we all know, the universality of our Medicare system ends as soon as you get a prescription, and then you're left on your own. Work plans are not always reliable, as we know, and which has become even more evident during COVID. Currently we have over 113,000 private plans and 70 public plans to cover people that cover differently. Everybody's experience is different. Sometimes the unaffordable co-payments create a huge barrier for people filling their prescriptions. In Alberta alone, we have over 23 public drug plans that cover only 20% of the population. So put it into perspective, is about 900,000 from the 4 million population that we have in this province. And yet consistently, we see this area being among the top 3 expenditures of our healthcare budget. Where you live, your age, where you work in Alberta, your income, and whether you have specific disease such as cancer, require palliative care, or suffer from a rare disease will determine who gets covered and what gets covered and what does not get covered. And we know that during this year, this has even been more prominent in terms of how people are having to not make those decisions that Brianne was talking about, whether or not they buy their medication or put food on their table. In between December 2019 and December 2020, we lost about 132,700 jobs in Alberta. We had the second highest amount of job losses in the country. So that's 5.7% of the jobs that were lost. In between November and December alone, it was 12,000. So if you were lucky to have a drug plan that covered your prescriptions at that point, then you know, you lost those services, and that left tons of people. Add that to the fact that our government on March the 1st, 2020, cut off about 46,000 Albertans off the seniors dependent drug plan that up until that point covered the dependence of seniors over the age of 65. You know, we also underwent an Alberta Health Services review this year, where they are recommending that seniors in long-term care start paying co-payments for their prescriptions. So this situation is not getting any better. And what we will be seeing in the next couple of months as we slowly come out of this pandemic is that this situation is going to become even more crucial. And the need for a Pharmacare program that covers absolutely everybody, Pharmacare for all, will be more essential and much more needed than we have seen in the past year or so. So we are very excited that finally we're seeing some movement in this direction. That I think in a lot of ways politicians will be called to the front to make their position known to everybody. There's all kinds of talks about an election looming, and this is where we need to be in a position of strength, where we need to know as much as we can about what we stand to gain with a national Pharmacare program. It's not a question anymore that we can't afford it. It's a question that we cannot afford not to do it. That's a lot of negatives, but you know what I mean. So I'm going just to give it to, hand it over to Heather, who will be talking to us with respect to the roles of opposition MPs and how it is that they can bridge this conversation. We both know that Brianne's premier, as well as our premier, has made it very clear that if the federal government implements a national Pharmacare program, that they will not be signing on to it. So we're going to have a lot of work when it comes to pushing and ensuring that our provinces are not left behind if there is actually an implementation of a national Pharmacare program. So I'm going to introduce Heather now. Heather was first elected as a member of Parliament for Edmonton-Strathcona in 2019, our very bright orange spot in a sea of blue. We were trying to figure out what description to use in a sea of blue, whatever that was. None of the words were very nice. Heather has 25 years plus of experience in building strong communities locally, nationally, and internationally. Most recently, she was executive director of an organization representing Alberta not-for-profit organizations that work on issues relating to poverty reduction, human rights, environmental protection, and gender equality. She has a Master's of Education from the University of Alberta and has taught around the world. Heather is currently the Deputy House Leader for the New Democratic Party. She also sits on the Subcommittee on International Human Rights of the Standing Committee on Foreign Affairs and International Development. And she also sits on the Standing Committee on Canadian Heritage. So we're very fortunate to be able to have her here. Heather?
Thank you, Sandra. Thank you for the introduction, and thank you for letting me be here. I realized today when I was sitting on our Zoom call in the House of Commons that I'm actually dressed up as Alberta. Like I'm all blue with my little bit of orange. So I'm very clearly taking my dot of orange in a sea of blue quite seriously. I also want to apologize to everyone that we did have to put the day or the time back a little bit. Peter and I were in the House until just moments ago actually debating the Pharmacare bill. So thank you for being patient. And I have to say, as someone, as Sandra mentioned, I'd worked in nonprofit for 25 years, and every single time we invited a politician to something, they always showed up late, and I was always like, oh, there's so much work. But now I'm the politician that's causing the trouble, so I'm sorry about that. I'm going to talk just for a few minutes because really who I think it's important that we hear from is Mr. Peter Julian. The bill that is being brought forward is, of course, C-213. It is Peter Julian's private member bill. He has done an enormous amount of work on it. He has much more information in his pinky than I have in my entire body. So I think it's important that we give him some time to listen to him, and he can answer a lot of the questions. I'm going to be here to answer questions as well, of course, but I'm looking forward to hearing from Peter. I thought what I would do is share a little bit of the information that I shared in the House during my debate today, tell you a little bit about how that went, and maybe a little bit of the Alberta context, because while I know that we have friends from Manitoba and Alberta here, I think the context is similar. And I think the battle is going to be similar. And from my perspective, and maybe people in Winnipeg or in Manitoba think this differently, but from my perspective, Jason Kenney is likely to be on the vanguard of attacks on our public health care system. And the risk, of course, is in many different fields that where Jason Kenney leads, that other provinces will follow. So we see that in terms of his declaration that he would not accept Pharmacare. We also see it in terms of labor rights. We also see it in terms of privatization of our healthcare system. Attacks on the public sector, attacks on schools. So all of those pieces are part of a bigger piece that we need to be very worried about. The attacks on people living with disabilities, a number of those things. So I think that's just something to keep in the back of our mind. It certainly is, for me, a very large burden, because as the only member of parliament for Alberta and Saskatchewan, for that matter, that is not a Conservative, I don't feel that the members of parliament from my province are stepping up for Albertans, particularly in this issue, not only in this issue, but particularly in this issue. And just to give you an example, just before I spoke in the House of Commons, the member of parliament for Calgary Shepherd spoke, and he spoke about the fact that we don't need Pharmacare because 90% of Canadians have Pharmacare. It's an outrageous claim that we've heard over and over again. It's not true, and the fact that these members of parliament are saying this in the House of Commons, from my perspective, means this is something that you need, that all Albertans need to call out their MPs on, and make sure that their MPs understand their role representing you. Another thing that did come up in the House of Commons just before I spoke was the idea that Todd Shandro is our compassionate, or Tyler Shandro is our compassionate health minister who has made drugs accessible for Albertans. And again, it was very difficult for me not to call a point of order at that point on hearing some of these things. So I guess just to start, I'm not going to be saying anything that is different than what you expect. We know Canadians need Pharmacare. We know Canadians have been waiting for almost 60 years. We know that the Liberal government has been promising Pharmacare for over 23 years. We know that we have five studies. We know that we have the Hoskins report being the most recent study, all suggesting that this is not just something that is vital that we put in place for Canadians, that it is also the smart economic thing that we can do for Canadians. We also know that we have this historic time that while COVID-19 has been really challenging for so many Canadians, for so many of us, people have, lost their lives, their loved ones, their jobs, their livelihoods. What it has also shown is that with political will, with the will of those that are in government, substantial changes can happen. Substantial changes that will increase the lives of millions of Canadians can happen. We're no longer going to be able to listen to our government say that it's not possible. It is possible. We know how fast things can move. We know that banks were given loan guarantees of over $750 billion in 3 days. We know that if this became a priority, that this could happen, and it could happen very, very quickly. It's vital that it happens. I know Peter's going to talk about some of the economic benefits and some of the facts around Pharmacare, but just to end to say that the biggest opportunity we have is right now with Bill C-213. And it is so vital that everybody's reaching out to their members of parliament, that their members of parliament recognize that A, that Canadians need and want Pharmacare, but B, that there is going to be a political price if they are not prepared to support what their constituents want. If our members of parliament choose to side with drug companies instead of Canadians, there needs to be a price for that. So I'll pass it over to Peter, and thank you, and I'm looking forward to answering all of your questions today.
Before Peter starts, I just wanted to let people know that we weren't able to find the icon for the questions and answers, so you're more than welcome to put your questions in the chat area. And then we will do our best to sift through them. So maybe perhaps just keep the chatting to a minimum and just keep it for the questions and answers. Sorry, Brianne.
Before you go into it, Peter, I'm going to introduce you to folks who may not be familiar with you, which may be a little shocking to some of us, but you were first elected as a member of Parliament for Burnaby, New Westminster in 2004. Peter has served over 12 years in Parliament and has worked hard for his constituents and fellow Canadians by helping them with a host of federal issues. He has served in a variety of capacities as MP and is currently serving as the NDP finance critic, and has a long, rich history in advocacy and in the community. And tonight, he's going to speak to us about her private members bill, C213. So without much further ado, Peter, please take it away.
Well, thank you so much. And I'm speaking to you from the traditional territory of the Kakite First Nation and the Coast Salish peoples, and acknowledge that in appreciation. And I wanted to say right off the bat, a big thank you to the Friends of Medicare and the Manitoba Health Coalition. You do extraordinary work, and you have helped us get to the point that we are at, which is only 7 days away potentially from a historic vote on putting into place public universal Pharmacare. And your work has been stellar and exemplary, and it's deeply appreciated. And I will say now, the next 7 days is absolutely critical. And your work is needed now more than ever. The next 7 days can make a huge difference. I'm always pleased to follow Heather McPherson. She is the best member of Parliament from Alberta, one of the best in the country, a rising star in the NDP, and does absolutely amazing work. And I think there'll be, because of her work, we'll see other members of Parliament elected in Alberta whenever that next election comes. She's just been amazing. I wanted to start off by talking about what just happened, what we just came from, and what that means about the next 7 days. The Liberals, since the bill was actually tabled, have not been talking about it, have not been interested in responding on it. In the fall, they tried to basically dismiss it, and a couple of Liberal members ventured out. Adam Vaughan did in Toronto. He put out a tweet basically saying that Pharmacare wasn't important. He used a more crude expression, but that's what he said. And there was such a blowback from Canadians that the Liberals simply have been silent on it now for the last few months. And all of that changed today because they had to respond on how they are going to vote on Pharmacare. So they put up their parliamentary secretary, and Liberals being Liberals, he basically said that he was going to vote against the bill, and then put out a bunch of comments about the bill, which indicated why he was voting against. It's interesting because it's very much a trial balloon. What the Liberals are doing is saying, hey, if we can get away with this, we're going to vote against this and kill the idea of public universal Pharmacare. So they put him out as the trial balloon. And my point that I want to make to all of the activists on this important webinar who have done such incredible work is we cannot let that trial balloon float away without puncturing it. His basic premise was, we don't need the 5 principles of the Canada Health Act incorporated into Pharmacare, that it's fine to let the provinces decide, and that somehow out of that will be something akin to universal Pharmacare. We know that that's not the case, that just having the federal government wade in and provide a little more patchwork to what is existing as a patchwork system, what that leads to is extremely high costs. And as we've seen in the United States when it comes to healthcare, because what the Liberals propose, if this is defeated, is very similar to the US healthcare system. It's twice as expensive per capita for each individual, and it leaves tens of millions of Americans out. And the trial balloon that the parliamentary secretary put up today is exactly that. That what they will do is talk with the provinces. Jason Kenney will decide whether or not there's some kind of extra drug ban that's put out. The federal government will put a little bit of money in, and we'll end up with a system that is as bad as it is today, more expensive, and doesn't deal with any of the fundamental issues that we are very key, we're aware of. The fact that millions of Canadians can't afford their medication, the fact that hundreds of Canadians die every year because they can't afford their medication, all of that will be pushed aside, and they'll announce some kind of national Pharmacare plan that really will be just a patchwork of of a partial plan, American-style pharmacare that does not leave us any further ahead. So if you believe that we need to have the 5 principles of the Canada Health Act incorporated into pharmacare, that we need to have a publicly administered program that is universal to all, that's portable between provinces, that includes comprehensiveness and accessibility. If we believe that, this next week is the time to fight and to push back on this trial balloon, and to not accept the idea that we have to have only a partial American-style drug plan that is basically incorporated in to the existing patchwork that leaves so many people out. So I know there's a presentation, and I don't know because everybody on this call I know is well versed in issues of pharmacare. I don't know if we want me to explain the bill, or if we want to talk more about the next week and the tactics that are so important to pushing Liberals to respect their commitments that they've been making now for 30 years to bring in public universal pharmacare, and to make sure that Liberals feel the heat and that they vote accordingly next Wednesday. And the final point I'd like to make is that you're all invited to a Pharmacare vote watch party that will be, I think, Central Time, probably 2 p.m. Starting next Wednesday, February 24th. Mountain Time would be 1 p.m. Pacific Time will be noon, and the vote should take place over the following hour, and we'll see each member of Parliament voting in turn.
Well, thank you for that, Peter. We do have some questions rolling in now. Sandra, do you want us to kind of move along to some questions then? Because I feel like
sorry, are you going to show the PowerPoint presentation? I think it'd be useful for people.
Okay, sure.
Yeah.
Okay, well then let's move ahead. And who do I ask to change the slides?
Elodie. Elodie is actually doing your...
Okay, well, hello, Elodie. She does amazing work. And I should shout out both to Elodie from my team, and also Doris Ma, who's the national coordinator for the Pharmacare Now campaign to get Bill C-213 through. So that's the bill is an act to enact the Canada Pharmacare Act. That's the long title. Short title is Canada Pharmacare Act Bill C-213. Next slide, please, Elodie. And why is national pharmacare important? Millions of Canadians are left out. Hundreds of Canadians die every year. We pay far too much for a system that actually leaves so many millions of Canadians out. And as the Parliamentary Budgetary Officer has indicated, we would save over $4 billion nationally to move to a public universal pharmacare program. Next slide, please. So on an international scale, here's the paradox, right? As with the United States, Canada pays much more, a total expenditure of on medicine compared to other countries that actually have in place public and universal pharmacare. And the country of New Zealand is illustrative of that. Once they brought in universal pharmacare, the actual cost of some medication went down by over 90%. Why is that? Well, because of the bulk purchasing power that comes nationally from having one national pharmacare plan, a public and universal pharmacare plan that means that the drug companies can't charge an arm and a leg. And so this means in terms of rare diseases, in terms of overall access, we actually spend less as a country in having better access. That's the paradox I know that everybody on this call is aware of. And that's what we have to keep hammering home, especially with the Conservative MPs who don't seem to understand basic finances and think that paying a lot for pharmaceuticals is a good thing because it creates research. It's simply not the case, we know. Elodie, next slide, please. So the result is 1 in 5 Canadians not having any wherewithal to pay for their medication, close to 7.5 million. That was prior to the pandemic. And the pandemic has exacerbated the immense problem of not having public universal pharmacare. The numbers estimate now go as high as 10 million with all the people who have lost their employment and lost their drug plans as a result of that. So the numbers are higher than what you see here. But it says it speaks to the incredible necessity to put in place public and universal pharmacare as quickly as possible. Next slide, please, Elodie. So we've got Jim's story. I wasn't able to speak to it tonight because I only had 5 minutes, but Jim actually has to beg his wheelchair. He's a person with a disability, and his wheelchair is right outside the House of Commons. MPs walk past him to get to the House of Commons. He's out there, minus 35 weather, blizzards, the stifling heat of the summer in Ottawa, because he gets $800 as a person with a disability a month, only enough to pay for a modest room and food. And his prescriptions that keep him alive cost $580 a month. He is one of the millions of Canadians that desperately need a public and universal pharmacare program. And I think, Elodie, if you can just put on the video, we'll hear his story a little more.
Tell us a bit about why you're out here, sometimes 6 o'clock in the morning, minus 30 temperatures. Why do you need to come to this bridge?
Because I need the money to pick up to pay my medication, or else I can't function well. I have a lot of problems.
How much does your medication cost every month?
$500.
And the only way to do that really is right now the generosity of people going by.
Yeah.
Yeah. What difference would it make if we had national pharmacare? And what would that mean to your quality of life?
I will need a lot, and I can go on living and be home more often for my granddaughters, my wife, do more stuff at home.
Yeah, that's why it's so important, and that's why the NDP is bringing forward the National Pharmacare Act in Canada.
Thank you, Elodie. If you can go to the next slide. And here's another story, Cole's story. They live a few blocks from me. The father of the family has heart medication that keeps him alive. His brother also has medical needs through medication. They spend over $10,000 every year on prescription drugs. You can imagine the stress on this family. Cole is in high school, and yet he sees every day the incredible impact of this financial pressure. How do we find the $1,000 this month when we're trying to put food on the table? We're trying to keep the kids clothed. We're trying to keep a roof over our head. And this is a story that is repeated right across the country. And what we said tonight is, if members of parliament actually listen to their constituents, the vote next week will be overwhelmingly positive, because Cole's story, Jim's story, and millions like them need to come to the forefront for us to put in place public and universal pharmacare. And the fear-mongering of the pharmaceutical lobby that has been intense around this, and we heard some of the MPs kind of repeating the pharmaceutical lobby lies tonight. We simply have to have the interests of people go before profit. And that's why these stories are so important to share. Next slide, please, Elodie. So what the Bill C-213 does, and it's followed by the Hoskins report, the advisory council suggested we needed a foundation. The foundation is the 5 principles that we have in our universal healthcare system. As I mentioned earlier, public administration, comprehensiveness, universality, portability, and accessibility. So for the Liberal trial balloon tonight, the parliamentary secretary is saying, well, no, we can't have preconditions. We're just going to go to Jason Kenney, and Jason Kenney will decide what kind of program we have. It's absurd, and it eliminates that foundation that Hoskins talked about. It would be a complete repudiation of everything that the Liberals have been telling us for the last few years. Next slide, please, Elodie. So we know with universal public Pharmacare, the cost of prescription drugs falls remarkably. For businesses, it's more competitive because the reality is we have about $6 billion that Canadian small businesses are paying into drug plans that will then be able to be invested for job creation and other things. And for families, it's a savings of about $5 billion a year that they're paying now. Those are the Canadians who can afford to pay for their medication. But of course, the quality of life for those who can't afford to pay for their medication, and the fact that we no longer will have the hundreds of deaths of Canadians that we lose every year because they can't afford to pay for their medication, that's uncountable in terms of the benefits to the country of putting in place public universal pharmacare. Next slide, please, Elodie. So we're asking people to tell your MP to vote yes. And that is through the Pharmacare c213.ca website. People can go on to the Pharmacare site and they put their address in and they can write to their member of parliament. You don't need to write to Heather, of course, or Daniel Blakey, or Leah Gazan, or Nikki Ashton. They're all very supportive in Manitoba and Alberta. Everywhere else, we got to put pressure on members of parliament. But as I mentioned earlier, we still have this issue around the Liberal trial balloon. They are preparing to vote against this because they think they can get away with it. We can't let them get away with it. And I think there's a final slide, Elodie, on the e-rally. No, okay. There, we are hosting an e-rally next Wednesday, and I think Doris put that up as well. And that e-rally will start basically at 3 p.m. Eastern, 2 p.m. Central, 1 p.m. Mountain, and noon on the Pacific Coast. There you go. There's the Pharmacare e-watch. Each member of Parliament will have to stand up, and we want to make sure, as Heather mentioned, we have to make sure that they cannot get away. If this trial balloon means that they think they can get away and simply call it, they're going to call it National Pharmacare, but it's not. It's just a patchwork that they'll throw a little bit of more money and hope that people don't tell it, can't tell the difference. Everyone on this call, the Friends of Medicare, the Manitoba Health Coalition, you are real experts on public and universal healthcare and public and universal pharmacare, and we've got to call them out on it, that this is simply not permissible, that they are going to destroy everything that the Hoskins report recommended, destroy the ability to put in place public and universal pharmacare, and instead have a little bit of patchwork where they throw in a little bit of federal money, and then they say, hey, look what we've accomplished. Mr. Trudeau will say, hey, we have national pharmacare, and it will not be true. It's not what you've been pushing and working for. It's not what millions of Canadians have been looking for and hoping for. It is a travesty, and we can't let them get away with it.
Sandra, you're muted.
Of course. Thank
The
you,
phrase of this
Peter.
pandemic.
I know you're muted. I'm sorry. I just wanted thank you for that presentation. I think it kind of put everything into plain view for all of us, and to know exactly where we're at. So I just wanted actually to start out with a question from Carl, so like it kind of sets the stage in the context of which all this discussion is happening. What exactly did the Liberals promise on pharmacare in their last campaign and for the last 30 years?
They have been promising public universal pharmacare on the model that we have talked about. The Hoskins report talked about that model as well, and that includes the 5 principles of healthcare. Not what Jason Kenney would put into place, with a ton of money being spent on private profit and no universality. It is what the Liberals have committed to was public and universal pharmacare, and that's what they brought to elections for the last 25 years, including the last election. The Hoskins report, they endorsed, and they said, this is what we need, public and universal pharmacare. Liberals on the Health Committee, when the Health Committee came up with a unanimous report, said as well, public and universal pharmacare, not this patchwork of private profit, and we fill in a few of the blanks and fill in a bit of the holes in the social safety net, and then we walk away and we say we have national pharmacare. A pharmacare program that mirrors our universal health care. Now, can you imagine a universal health care where some people, if they go to the hospital, can get in, and others, well, if they get $100,000 together, they can get in? That's basically what the Liberals are proposing for pharmacare, instead of the system that we have for healthcare. And so that's the distinction. That's why they've been quiet for the last couple of months. They've been listening to the pharmaceutical lobby, we know, but they've been quiet because they were trying to judge whether or not they could get away with it. And now they've attempted today to set the scene for the final week to see if they can get away with much less than public and universal pharmacare.
Okay, so our work is definitely cut out for us. I have a question from Avril, who says that our Conservative MP represents the largest Indigenous reserve in Canada. Can someone speak to the relation between C213 and the coverage for Indigenous persons?
Peter, you go ahead on this one and I'll jump in after. How's that?
Okay, sure. That sounds great. I mean, the current coverage for Indigenous people is lacking, full of holes, misses massive amounts of medication. We've certainly been hearing across the country from Indigenous peoples that are not well served by the existing system. That would not change if this bill is rejected. If the bill is adopted, and this vote next week is the first of a couple of votes that needs to go through third reading, but if it passes next week, it's likely to pass third reading and then get through the Senate. But the idea that we enhance the ability to ensure medication for all, and that the medication is free in the same way our healthcare system is, that would be an enhancement for Indigenous peoples across the country who are not well served by the existing paternalistic and colonial system.
The only thing I will add is that within our party, we've got some very, very strong advocates that are pushing this. We were debating Bill C-15 in the House today, that is the bill on UNDRIP, the United Nations Declaration on the Rights of Indigenous Peoples. And I think it's also very important that we make sure that these conversations include Indigenous people and that they are part of that. And certainly at our caucus table within our party, that is the case.
So we have a question: how will this help disabled and aging adults who have disabilities? As it stands, there is little to no supports anywhere in Canada.
Peter, I'm going to pass it to you again. You're the specialist on people living without disabilities. What do you not know?
Well, Jim is a great example. Person with a disability, $580 a month. We know that people with disabilities are the poorest of the poor in Canada. Half of the people who have to go to food banks to make ends meet, they're people with disabilities, and half of the homeless in this country are people with disabilities. I mean, the crushing burden of not getting any sort of medical support, medication support for people with disabilities has been incredibly difficult for each and every one of them across the country. And having universal Pharmacare in place allows finally people with disabilities to start to be able to have a better quality of life. That's what Jim was speaking to, and certainly in the consultations we've had with people with disabilities right across the country, there's been overwhelming support for having public and universal Pharmacare because it makes such a difference.
And I also think that it's, you know, when we look at it from the Alberta context, which I'll speak to just a little bit, we have seen this current provincial government attack people living with disabilities through a number of different methods, you know, whether it's changing the date that AISH gets paid, whether, you know, it's threatening to cut AISH, whether it's cutting off benefits to people that are dependents. There's been so many attacks at the provincial level that this is also so vital that we have this put in place at the federal level. You know, we need to fight on multiple fronts, but this is one front that's very important that we're pushing on for Albertans living with disabilities.
We have a bit of a political strategy question here from Patricia, who says, my understanding is that the NDP holds the balance of power. Wouldn't it be in the best interest of the Liberals to go along with the NDP on this bill?
Well, we of course think that it would be a very good idea for them to go along with this bill. There's a lot of things at play here. I mean, first of all, the Liberal government may not want this government to be lasting. They would probably like to take us to the polls. I don't think it's a good idea for us to be going to an election in the middle of a global health pandemic. I think we saw what's happened in the Maritimes just this month is disastrous. To think of going to polls and going through an election at this point. It's not what Canadians are concerned about. But it's possible that the Liberals would like to do that, and so that's something that takes a little bit of that away from us. But the other thing I would point out is that the Liberals don't want to do this. They want to continue to promise Canadians universal accessible pharmacare without actually having to put it in place. They actually like the drug companies. They're actually fighting for the drug companies exactly the same way the Conservatives are. They're just not wanting to actually admit it. And so what, you know, it's such an MO to do study after study after study and never actually do it. We've seen it with childcare, we've seen it with international development assistance, we've seen it with just so many things, climate change, where we'll see study after study after study, but not that concrete action. You know, and I'm new to this. I was on the other side of the table just a year and a half ago. Peter's been fighting this fight for longer. So Peter, from your perspective, why are the Liberals not supporting this?
I think they honestly think they can get away with it. But the way they do it, they don't do it honestly. They didn't say a few months ago, "Oh, we're not going to vote for this." They have been judging whether or not the activist pushback is big enough for them, and then they're prepared to accept it. If it means it costs them seats, they would vote for the bill. Obviously, what they're more concerned about, because this follows exactly the recommendations of the Hoskins Commission that they put into place, is the NDP getting some credit. And we've said it doesn't matter about the credit. What matters is getting things done for people, which has been Jagmeet Singh and the entire NDP's caucus. This has been our work from the very beginning. We've done a tremendous amount of work to get programs in place. Not perfect to deal with the pandemic, but we haven't been screaming who gets the credit. We've been just getting the job done. And in this case, it shouldn't be that the Liberals think about the NDP. Maybe we should do this for the NDP. So for the minority parliament, they should be doing it for Canadians. They should be doing it for the 90% of Canadians that support public and universal pharmacare. They should be doing it for the 7.5 to 10 million Canadians that have no medication coverage. They shouldn't be doing it for us. They should be voting yes because it's the right thing to do. It's because they promised to do it. And despite the fact that we had to do the work for them, this is exactly what the Hoskins report recommended. So that is why they should be voting yes next week.
Okay, and as some of the other folks in that hold office like to have the economic argument, again, National Pharmacare in this setup will save a lot of money and is actually the most prudent of us to follow if we're looking to save money and if that's our end goal with some of the political parties in power right now. I do have a couple of questions, one of which is, if Bill C-213 passes, would deductibles or other prohibitive access be allowed to continue as it currently does in BC and other provinces? Would this cover other supplies like insulin supplies?
I mean, it should. This bill, though, is the framework that then leads to discussions with the provinces around finances and the formulary. So yes, it should include insulin supplies, no doubt. It should eliminate all of the barriers that make it accessible as a pharmacare program, which should include the copays, which often in British Columbia were very punitive. We've had federal governments that haven't been enforcing to the letter the Canada Health Act. We certainly saw that under the Conservatives and the Liberals. If Jagmeet Singh becomes Prime Minister, if Mr. Trudeau forces an election this spring, these punitive copays that people cannot afford to pay, it's just another way of trying to get around having a universal healthcare system or universal public universal pharmacare system. These are not things we'd entertain because we would make sure that there's adequate funding for healthcare and that the provinces have an obligation to follow the Canada Health Act.
Well, and I think one other thing to keep in mind too is that this actually, if we have a national program in place, it actually protects Albertans, it protects people in Manitoba against what Kenny and Pallister might try to do. It actually gives us more protection against any cuts to our services that they might do at a provincial level. It gives us that buffer, that national protection that frankly we need in Alberta right now.
We most definitely need it here in Manitoba. So that is very much, I think there's this perception that they're just going to do the right thing. The Liberal government feels the provinces will, and that's just not the case, and that's not how it's panning out in Manitoba in relation to the Health Act. As we've seen, they've gotten their hands slapped a couple of times, yet there's no repercussions. So it's very interesting what's unrolling right now. Are there any provinces that you know of that are really gung-ho about national pharmacare?
Peter, you go
Yeah,
ahead.
okay, thanks, Heather. Atlantic Canada is very supportive. BC, of course, very, very supportive. Quebec is interesting because we've had over 40 municipalities, cities, towns, and villages in Quebec saying, asking their members of parliament to vote yes on Bill C-213. And the big union confederations have all said we need public and universal pharmacare. They have a patchwork that hasn't worked well. A lot of Quebecers are left out. There's a private component for profit, so it's very expensive. So it's very much a slightly improved version of the U.S. Approach on healthcare. Costs more per person, leaves many people out. And so Quebec is interested, I think, more in terms of actually getting in place a real system that would be public and universal. Is Doug Ford, Jason Kenney, and others, the Saskatchewan and Manitoba premiers, are they supportive? Not to the same extent. And Jason Kenney, of course, I'll leave any comments about him to Heather. But the reality is, on our universal health care, it evolved as well. There were provinces that were opposed at the beginning when we put in place universal health care that didn't come along right away. And what happened is their population said, why the hell is that province people having full universal health care and we don't? We are in this situation where we have to bear the financial burden ourselves. So what happened was, over time, over a few years, we ended up with our universal healthcare system as we know it now, with those 5 principles. So in Pharmacare, I don't doubt that there would be some obstacles and some provinces with premiers that would refuse to get involved initially. But I also know that in Alberta, Jason Kenney may not survive the next election, and I think Premier Rachel Notley would definitely put it into place. So yeah, we have to wait a couple of years in Alberta. It would still come to being, because currently provincial governments are spending about $12 billion on this patchwork of partial plans. And so the federal government stepping up with its spending power and saying, hey, we're going to save you billions of dollars, as well as make sure that everybody in your province has access to public universal pharmacare. It's a no-brainer for a provincial premier. You'd have to be ideologically hidebound to say, no, we're going to keep spending money on a system that doesn't work. So there's an advantage for the provinces as well. And I have no doubt that it would take a very short period of time to have in place for Pharmacare what we already have in place for our universal healthcare system.
Perfect. Thank you, Peter. We're just going to ask a couple more questions. I know that Peter's had a long day. We were in a different meeting earlier today, and it's been nonstop for both of them. So thank you so much for sticking around. But we've been asked this question quite a few times in terms of examples of who's lobbying against this Pharmacare program. The insurance companies and specific drug companies and their allies, and how is this playing out in this whole conversation nationally?
It's unfortunate. I'll start off by saying, though, it's only 6 p.m. on the West Coast, so I'll stay as long as you want till all the questions are
awesome. I forget you're in the West Coast.
Oh yeah, I'm just waking up. I'm sort of an evening person, so this is the time for me. Very, I would say, diabolical. In terms of the pharmaceutical industry, they've been, and I will say this frankly, they have been profoundly dishonest with people who have rare diseases, and they have basically threatened those folks, some of them in organized groups, saying, with public universal pharmacare, you won't have access to your medication anymore. It is diabolical. It is profoundly dishonest, but that's the pharmaceutical industry is basically holding people who are fair, open-minded and want to have the best system in place for their loved ones as well as for all Canadians, basically holding them hostage with fear-mongering and attempts to say you're going to lose all of this. And we saw some of that reflected in Conservative comments both in November, but tonight as well. Mm-hmm. The insurance companies have been talking about the loss of jobs as if that's something that is more of concern to them than the profits that they glean. So both sectors have been the highest opposed to this, but they're both using, I would suggest, very disingenuous tactics. But I see it repeated by some of, particularly the Conservatives, and it shouldn't go unanswered. We've certainly replied when we've been speaking to the rare diseases groups, and we've been talking about the issue of employment as well. And it's simply that type of opposition is simply not substantial. It's really all about profits in both sectors.
And I have to say too that the other area or the other sector that we have to think about that is really opposed to this is our conservative premiers, is our conservative provincial governments. And one of the big pieces that we've seen, I mean, one of the pieces from the Hoskins report is that public administration piece, that this is publicly delivered, that's something that we've seen time and time again, that Jason Kenney is attacking that principle of publicly delivered healthcare, publicly delivered, publicly administered services. So that's another, I mean, that's really another one we really have to be pushing up against, and we have to be calling them when they say it's cheaper, when they say it's better for Albertans. It never is. It's not. It costs more. We get less services. We get less jobs. It's always a bad decision, and it's always done because the people that support Jason Kenney and the UCP benefit from it.
Very much. Thank you for that answer. It kind of indirectly goes into another question here in terms of pharmaceutical companies and in how we benefit from the research at public universities and labs. And I know that both Manitoba and Alberta are currently sharing Providence Labs, who is putting forward COVID vaccine a sell in terms of selling to both Manitoba, Saskatchewan, and Alberta. And so Manitoba has agreed to give them how much money to do the first trial?
Well, they haven't completed their trial, so we're putting up 7.2 million that's non-refundable, and then a total of 36 million at the end for 2 million doses if it proves to be viable. But they're only in stage 1, and both Alberta and Saskatchewan, according to our premier, are courting them as well in regards to this vaccine. But again, it's very clear that it's not something that's going to be prudent for Manitobans or Albertans at this point in time, considering where they are in their testing phase for this particular vaccine.
And how many millions? Yeah.
Yeah, and I think it is a clear, to Heather's point, there is a clear attack on public services, whether it be healthcare or unionization, for example, or wages. There's been a number of very similar pieces of legislation passed in Alberta that have also been passed in Manitoba, and it's been very clear that there's a road towards privatization that needs to be stopped, especially as it relates to Pharmacare. But for us, it's really about the next steps of taking action. So we have a week to really make our voices heard. We've heard a couple of ways that people can participate through Peter Julian sites that were posted in the chat, but also I want to really remind folks to pick up your phone and talk to your MP's office. I think we've lost that fine art of dialing the phone and talking to a fellow human being. It's usually text messages or direct messages. And I think it's really important for folks to share their personal stories and how National Pharmacare is going to impact them and where their MP is going to be voting. And I think it's not just about you individually, but also recruiting your friends and your family and spreading the message about why this is important and why we can't let up and why we have to keep pushing, because as we've been talking about, Medicare wasn't just given to us, it was fought for. And so we're going to have to keep fighting for Pharmacare. And this means a hard week of a lot of effort for all of us to make sure that we're not shy, picking up the phone, talking to our MPs, but also engaging on social media as well to ensure that we're also spreading the words on our social media channels. Because I think one thing that we've seen demonstrated in Manitoba is a viral Reddit post will actually get action from our government when it comes to actually taking action and protecting Manitobans in long-term care facilities. So I think that there's every avenue at our disposal we should be taking at this point in time. And Sandra, I think you have some other things to also highlight as well.
Sure. You just kind of went ahead a little bit of my last question to the panelists, and I think it just kind
I'm
of
just
built
really
up.
excited about
I was so
Pharmacare.
excited just to let you guys, there were several people have asked us throughout the whole webinar, given that Kenny and Palliser, for example, have indicated that they're unwilling to join a national Pharmacare program. How can we get them to act apart from all the wonderful messages that Brianne shared with us?
Well, you can vote them out of power. I mean, that's what we should do in 2023 for sure. But there's other ways too. I mean, I can't even, we've seen Jason Kenney be forced back from decisions that the UCP government has made because of the uproar from Albertans. You know, we had this phenomenal uprising when he attacked our parks, and he had to peel that back. The coal policy, he had to peel that back. There is no chance that Jason Kenney will be able to withstand the public pressure if Canadians have Pharmacare and Albertans don't. There is no chance that he will be able to survive that with such overwhelming support from Albertans and from Canadians. He will bluster. He will find a way to blame it on Trudeau, but he will have to join on. Frankly, that's my perspective. But perhaps you have a different one, Peter.
No, I completely agree, Heather. But I would say that the fight right now is not at the provincial level. The fight is we have a federal government now that is backing off on commitments it solemnly made in 2019 that they would put into place, public and universal pharmacare, and they need to be called on that. So I completely agree, Brianne, about the phoning and contacting your MP, but also don't accept their guff. They will say, you know, if you've got a Conservative MP, they'll say all rare diseases that they won't have access to that, and call them on that. That's malarkey, absolute malarkey. It's simply not true, and they are being influenced by the pharmaceutical lobby. When they talk about cost, how do we afford it? There's a Conservative MP tonight that talked about, well, the parliamentary budgetary officer did the estimates, but I'm going to throw in another $20 billion, and that means that Pharmacare is not economical. Just bizarre stuff. Call him on that. The parliamentary budgetary officer has more credibility than you do, so don't tell me it's going to cost more when we know it's going to cost less. And for Liberals, when Liberal MPs, particularly in Manitoba, when they try to pretend, hey, you know, we just have to negotiate with the provinces, tell them that is malarkey too, that what the Hoskins report recommended, they need to do. And for Liberals particularly, if you say, I am not going to vote for you, if you do this, if you vote no, I'm not going to vote for you, that will have a powerful impact on them as well. And that's what we're asking activists to say right across the country. You lose the vote of everybody who supports that universal public pharmacare if you vote against it and try to find some pretext or excuse that, well, we're just trying to work this out properly and we have to talk to the provinces first. That's not what Hoskins recommended. They should do the right thing. Don't accept a no from them. Be polite, always be polite, and don't insult them personally, but be determined. And if they won't answer the phone, send emails. And if they don't answer their emails within a day, write to the local newspaper, go to the radio open line and say, and raise it, even go outside their constituency office with a few signs and say, we want you to vote. We want you to vote yes, and raise a ruckus, because as you both said, it is absolutely essential that people fight. If we hadn't fought for it, we wouldn't have had universal health care in this country. We're going to have to fight for public and universal pharmacare.
Yeah, and the only thing I would add is make sure you go on social media too. There is that,
yeah.
There is that, and that, you know, you can follow Peter, follow me. You can go on social media and make a ruckus there, but also write to the Prime Minister, write to the Health Minister. This is the time to really add our voices and let the government know this is not just gonna fade away. This is not going anywhere. They're going to have to act on this.
Yes. So thank you so much. What we will do is we will actually send all the links that we've posted throughout this whole webinar to absolutely everybody that signed on to this webinar, so that you know exactly when to join the watch party, who to write. We also encourage you to go on the Friends of Medicare website. We have a template for a letter if you don't want to write your own. Friends of Medicare is also part of the Alberta Pharmacare Working Group, and we've been able to lobby significantly around this issue, you know, and now it's going to be a time for us to kind of reorganize even stronger. We've had meetings already, and again, this is time where we can start using social media. I know that on the weekend, people were taking pictures of themselves with a sign that said Pharmacare for all. We need to continue to do that. A couple of maybe or so a year or so ago, we did that, and we had over 400 tweets that day. We were trending around the Pharmacare Twitter. So all those things are going to be organized in the next couple of days. And we are fortunate in the sense that we got a lot of phone calls that we can actually make. So definitely phone your MPs. Leave messages for them. Mine doesn't even live in my constituency. He lives in Ottawa with his friends, so it's a little bit hard to get a hold of him. But this is a time where we need to push. We need to make sure that our voices are heard, that all the work that we have done for the last 2 decades kind of hopefully will come into some success, and we can actually see some real move towards a Pharmacare program that will be there for all Canadians, no matter where you live and no matter the size of your wallet. So that's what we're striving for. If you had any questions that were left outstanding, we will try and get them answered. I'm sorry that we couldn't work out the question and answer a little bit more clear, so there was a lot of things coming in. I want to thank Peter and Heather for joining us today, Brianne for being an awesome co-host, and of course for Alyssa and Doris and Elodie. Did I pronounce that right? For being there to support and help us organize, and Gail as well, who's not on here, I don't think. I don't know if she's on, but who made all this happen. And I want to thank all of you for taking time out of your own schedule to join us, and hopefully you'll walk away with some energy and desire to kind of make sure that we push this to the in line. And you know what, this is going to be a situation, is a win-win. If the bill doesn't go through, at least we know who it is that we will need to target for the next time. We want to see this become a reality, and our basically our task is there, and let's all take it up. And thank you so much for coming to be with us tonight.
And thank you, Sandra. Got to thank you as well for all your hard work. Thank you so much,
everyone.
Peter and Heather, for staying with us after such a long day.
Have a good night, everyone.
Thanks for all your amazing work. If we get public and universal pharmacare, it'll be in large part due to your efforts. So thank you.
Thanks so much, Peter, for all your work as well. This is amazing. Thank you.
Bye-bye, everyone.
Remember your fundamentals.